What's going on, people? Welcome to Food Chest. Hope you're doing well. Top of the day to you. Let's get right into it. All right, so I'm going to start with a question. And that question is, what can Africa learn from America's ongoing investigation into the COVID-19 response? If you're not aware, there has been a lot of congressional hearing pertinent to COVID-19, and Dr. Fauci has been pleading the fifth like 1,000 times. So it just got me thinking, like, this is weird. And it just, as we know, this channel is all about Africa. It just got me thinking, so what is going on in Africa? What are African leaders doing? Are they listening to this hearing? And are they asking questions? But before I proceed further, let's talk about this a little bit. And I'm going to explain the angle I want to proceed on. Now, we're hearing a lot of scrutiny on Dr. Fauci, including congressional questions about pandemic decision making, the communication that was done during the time, research funding, and how scientific uncertainty was communicated to the public. And again, while I'm not going to focus a lot on politics of it, party alliance, and all that stuff, I'm more interested in the bigger question, which is pertinent to this channel. And that question is, what did COVID-19 reveal about Africa's dependence on the rest of the world for vaccines, pharmaceutical products, scientific research, and public health expertise? And that's where I want to take this conversation to, basically, right? That's the angle I want to focus on. Now, as we all know this, Dr. Fauci became one of the most recognizable faces for America's COVID-19 response. Now, years later, congressional investigations are still examining decisions made during that time, including questions about the communication and the modes of communication that were used, research, the funding, the origin of COVID-19, and how information was presented to the public. The important thing here is to separate what has been proven from what is still being investigated, right? And that's exactly how I'm going to approach the conversation. Now, what does this investigation actually mean? The investigation doesn't automatically prove that the doctor is wrong or he's right about everything that happened. But however, there are questions. It raises the questions of what officials knew, when they knew it, how scientific uncertainty was handled, how government communicated changing evidence, how research funding was used or overseen, and whether the public received complete information. Now, all of these are legitimate questions, but here's where I want to shift the conversation. And this is the area, like I mentioned, I want to focus on, right? Instead of spending the time on like Fauci, I don't want to do that, right? What I want to do is talk about Africa. So let's do that and that's the bigger question. Now, COVID taught everyone in the world something important, and I hope it taught the continent of Africa an important thing as well. The thing that COVID taught us is that during a global crisis, the countries that control the science, technology, manufacturing, and supply chains have enormous power. Africa discovered that it did not control enough of those things. De facto. Now that brings me to another question. Again, what happens when Africa needs medicine or vaccines, but Africa doesn't manufacture enough of it? What happens? And why does this matter for Africa? So let's look at this during the pandemic, right? So during the pandemic, we know that African countries had to compete for vaccines. They had to compete for medical supplies, for technology, and expertise, while wealthier countries were often able to secure supplies first. So the conversation isn't simply about vaccines right now, right? And again, going back to what did COVID teach us? So it taught us that it's not just about medicine and vaccines. It's about health sovereignty. That's the main thing. It's about independence. And that's always the question. Is Africa really independent? These are the questions.